What does a radiologist look for in a brain scan to diagnose stroke? Imagine you're trying to figure out what's happening inside the brain when someone shows signs of a stroke. A radiologist's job is to carefully examine brain images to find clues that point to what kind of stroke it might be and how severe it is. The first thing they do is look for signs of bleeding in the brain, because bleeding requires very different treatment from a blockage. They usually start with a non-contrast computed tomography scan, which is quick and effective at spotting blood. Bright spots on the scan indicate areas of bleeding, and if they see these, they know it's a hemorrhagic stroke, so they avoid treatments that could worsen bleeding. Next, if no bleeding is found, they look for early signs of ischemic stroke caused by a blood clot blocking blood flow. On a CT scan, this might look like darker, hypodense areas where the brain tissue is starting to suffer from lack of oxygen. They also check for loss of the normal distinction between gray and white matter, especially in the middle cerebral artery territory, which is a common area affected. To measure how much of the brain is affected, they might use a scoring system called the Alberta Stroke Program Early CT Score. Lower scores mean more extensive damage and can help predict outcomes. Magnetic resonance imaging is even more sensitive, especially diffusion-weighted imaging. This type of MRI can detect areas of brain damage within minutes to hours after symptoms start. Bright spots on diffusion-weighted images show areas where brain cells are dying due to lack of blood supply. Other MRI sequences, like FLAIR and T2 weighted images, also help identify infarcted tissue but tend to show changes a bit later than diffusion imaging. A key part of stroke diagnosis is figuring out if there's a penumbra, which is tissue that's at risk but still salvageable if blood flow is restored quickly. Advanced imaging techniques like CT perfusion or MRI perfusion-weighted imaging help differentiate between dead tissue and tissue that could still be saved. This information is vital for deciding whether treatments like clot-busting drugs or mechanical removal of the clot are appropriate. Radiologists also examine the blood vessels in the brain using CT angiography or MR angiography. These images reveal blockages, narrowing, or dissection in major arteries like the internal carotid or middle cerebral artery. Finding an occlusion helps determine the cause of the stroke and whether procedures like thrombectomy, which involves removing the clot, might be needed. Finally, they look for secondary signs such as swelling, loss of normal brain contours, or involvement of deep structures like the insular cortex or basal ganglia. These signs can tell them about the severity and timing of the stroke. They may also use scoring systems like the National Institutes of Health Stroke Scale to connect clinical findings with the imaging results. In summary, a radiologist's role in stroke diagnosis involves a detailed assessment for bleeding, ischemic damage, tissue viability, blood vessel blockages, and overall brain involvement. They use a combination of imaging techniques to gather all this information, which guides urgent treatment decisions and helps predict recovery. Always remember, if you or someone else shows signs of a stroke, seeking immediate medical attention is crucial, and healthcare professionals will perform these detailed scans to determine the best course of action.